Welcome to Module 2 of the 2025-2026 Antioch University Clinical Preceptor Training. My name is Dr. Paige Simonello, and I am the Clinical Education Coordinator of Antioch, and I will be taking over your preceptor training modules from here on out. So I just wanted to thank you all again for adjusting and being willing to do this via an online platform rather than in person. I appreciate all the emails, texts, and phone calls as we begin to set up our fall rotations. And I'm really looking forward to working with all of you in the future. I think Dr. Ali Smith did a great job with Module 1 and getting you familiar with Antioch University and the overall structure of our MSAT program. So in this module, we're going to be reviewing the CAATE accreditation standards that guide and support your role as a preceptor within our program. So after lots of hard work by our program director, Dr. Ali Smith, our MSAT program is officially accredited by CAATE, known for obviously their fancy name is the Commission on Accreditation of Athletic Training Education. And CAATE is essentially the governing body of athletic training education that ensures that we meet high academic and professional standards, which then prepare our students to pass the BOC exam and ultimately deliver the best patient care possible. So continuous assessment keeps our program aligned with ever-evolving healthcare demands, and as a staff, as a faculty, as a team, including you all, we hope to pride ourselves on being a program that remains in excellent standing with CAATE throughout the duration of our program. So it's important to understand that CAATE standards apply both to the program faculty and the program's clinical preceptors, which obviously sounds like a no-brainer, but it's important to note that they create a framework for high quality, evidence-based education and clinical experiences. For you as preceptors in particular, these standards help clarify your responsibilities in supervision, student learning, and overall student assessment, which are three of the biggest criteria that we can ask from a clinical education standpoint. So unfortunately, this is the part where things are probably going to get a little boring for you, but it's essential for us to spend some time looking at the specific standards that will most commonly be seen by you and evaluated within the clinical education setting for our students. So the first three standards that we're going to look at are very simple. Standard 22 requires that all clinical sites have a signed affiliation agreement with us as a university, as a CAATE accredited program. Layman's terms, no agreement, no students, and it's as simple as that. Lucky for you, because you are all on this preceptor training, it means that we have a signed affiliation agreement that has been stowed away in my emails, in paper copies in my desk, and probably locked away in a file somewhere so that I don't lose it. Standard 31 mandates that only athletic trainers or physicians may supervise athletic training students. And then finally, Standard 32 calls for ongoing communication between preceptors and the program, and specifically me as the clinical education coordinator, to assure really that nothing falls through the cracks as our students are out at your clinical sites. It's a huge goal of mine as I step into this new role to have good communication with each and every one of you, and not just communication when there's a need or something has gone wrong. I really want to have a constant communication with you all, even just about the good, or even just a check-in, to say hello. I really hope to get out to your clinical sites a lot and continue to develop and form these relationships that we've already started. So, next, we'll touch on two standards that are most directly related to you as preceptors, as individuals. Standard 45 outlines the qualifications that are needed to be a preceptor. Those being that you are a licensed healthcare provider, you are certified by the BOC, you are state credentialed, obviously, most of you being the state of Ohio. You have an NPI number, and finally, that you meet all of the state and national requirements for continuing education within the appropriate reporting period. And then Standard 46 defines your core role as a preceptor, and that is to supervise, mentor, and evaluate students according to our program's policies and procedures. So, CAATE standards, why do we have them? Why do they matter? CAATE standards ensure consistency and quality across clinical education. They help to guarantee that our students have meaningful experiences, proper supervision, and are exposed to diverse patient populations. These standards help to prepare students to become more competent and more ethical athletic trainers. So, our first key clinical education standard is Standard 58, and that emphasizes patient education and self care. And then Standards 59 and 61 follow closely behind, and they focus on effective communication and interpersonal collaboration. So, I really don't want to sit and dwell on all of these standards, but I do think it's important that you are familiar with the main goals and the things that we're asking our students to really strive to achieve throughout their clinical rotations, the things that they're going to be reporting in typhon, which we will touch on in a later module, and just really be able to have that open dialogue with them about where there may be areas of strength or weakness. So, standards 65 and 66 are the last of the true clinical education standards that you as preceptors need to focus on. And these two standards ensure ethical clinical practice and compliance within laws and regulations, including HIPAA, FERPA, and OSHA standards. So ultimately, as a preceptor, your example sets the tone for all the legal and professional behavior that they are going to see. There's no doubt in my mind that they're going to have excellent examples of this, which is why you are all selected as preceptors to join our team. So next we look at the CAATE standards that really focus on clinical skills and proficiencies. And they're what shape our students' hands-on development while they're at their clinical rotations and clinical immersives. So these proficiencies are going to be those that are primarily documented in the Typhon system and reviewed by you as the preceptor. Truly evaluated, provide them feedback, and make sure that they're improving on them throughout this semester. It's the goal of each of these clinical proficiencies to be validated for both competence and overall progress throughout the semester. So, the first three standards that we look at, standard 69, 70, and 71, focus on overall comprehensive patient care. So, this looks at assessment all the way to outcome based care planning and emergency response, as well as diagnostic exams. So, these standards are really the core skills that our students need to become that they need to become efficient in order to make sure that they're delivering safe and effective clinical practice. So I hope, it is my hope and a goal for all of our students to put these standards in to TIFE multiple times. These three in particular are things that I hope are not just a one and done evaluation, something that they submit to you one time and never touch again. I really hope that we can continue to touch on these standards and improve on these standards throughout their semester with you. The next group of standards, so standard 73, 76, and 77, cover therapeutic interventions, concussion management, and behavioral health. So students must learn how to intervene appropriately. They must learn to follow appropriate return to play guidelines and how to support mental health in collaboration with other healthcare providers. These are three very important standards in which observing the way you as a preceptor manage and navigate these situations will be really helpful for our students and understanding how they should approach these situations in the future. Next, we talk about some clinical standards where I feel like our students may be a little uncomfortable just because some of them address the unknown. These standards emphasize the use of assistive devices, which they should have practice with, but then they also address the prevention of long term conditions, involvement in pre participation exams, and hydration and nutrition counseling for student athletes. So, even if your students are not directly managing the patient care for these standards, it's really important that they get as much exposure to these topics as possible throughout their clinical rotations and their immersions. One thing that our students have been told from the beginning is if there's an opportunity this fall for them to be involved in the pre participation, evaluation, exam, physical day, whatever you call it at your institution, we are really encouraging them to do so. And even if it's a matter of you not feeling comfortable with them doing something, again, directly related to patient care, having them take the students around, having them check the folders for signatures, making sure there's nothing left unanswered on their PPEs, things of that nature to get them involved and understand what an important process this is as far as a season screening goes is really important to us, and we really encourage you to make them be there. I'm trying to fly through it as much as possible because obviously I know that this stuff is quite boring for you all. So we are getting down to the last of the standards, and this is standards 86 through 93. And this is going to be a big, big piece of their clinical rotation because these standards address protective equipment, documentation practices, collaboration, primarily with physicians, but as well as other healthcare providers, and addresses policies and procedures for emergency response, particularly concussion management. So, these standards obviously reinforce safety and preparedness in clinical environments. And as you move through your fall season, I hope to see students reporting a number of proficiencies within this domain and hope that they continue to gain both exposure and confidence in this area. Um, I know that many of our students, especially our first years, have not had much, if any, clinical practice at all or seen a whole lot done. So this is a big area of growth for them. So as we did in module 1, we will wrap up with a quick quiz to just reinforce your understanding of this module. This module obviously based on CAATE accreditation standards, so the quiz will help confirm the key points of those education standards and the importance of emphasizing these clinical proficiencies within our program. I, again, very, very much appreciate your time. I want to make these as short, sweet, and to the point as I can so that I don't take up a bunch of your time. But I very, very much appreciate your guys' willingness to, again, get familiar with our program, get familiar with the things that we as a faculty think are extremely important, and how basically how can we address the goals of our program and make our students better. So, I look forward to chatting with you in module 3. Good luck on the quiz, and I will talk to you all soon. Thanks so much.